Joining us now, emergency room physician at Tampa General Hospital, Dr. Jason Wilson. Dr. Wilson, thank you for being on with us. I guess, first of all, how did Tampa General fare through Hurricane Ian?
Well, we were very prepared, and we were also obviously very fortunate compared to our neighbors down south. Our team members were all here. The aqua fence was up, and fortunately, we sustained very little damage. We're really now we're trying to assist other hospitals in making sure their patients can stay safe and get those patients here if needed.
So exactly, tell us how you were able to help at this point. We understood at the height of the storm there were up to 9 hospitals in Lee County without water, 1 hospital that had significant damage. What kind of needs are you able to meet to help other hospitals that bared the brunt of this hurricane?
This is where, fortunately, relationships and regional networks really pay off. We have a transfer network built throughout the state of Florida, the Central Florida area. We're a large quaternary care hospital. We receive transfers from Lee all the time, our neighbors down south in Fort Myers, Punta Gorda, those areas. So we're well equipped and we understand how to bring in those transfers. At a facility like ours with trauma surgeons, neurosurgeons, really any type of specialty that you could imagine. We heard the CEO mention neonates and NICU. We have the ability to transfer those patients here as well. So we're working hard to get those patients here if needed.
So you're transferring patients still right now. How many patients are you taking in and from where?
Yeah, I can't comment on specific numbers. I just don't know where we're at right now, but we always are bringing in patients to those areas, and specifically in those areas hardest hit, where our CEO is working with those other CEOs to help arrange those transfers through our established transfer networks, including Lee County.
Got it. Yeah.
Dr. Wilson, good morning. Thanks for taking some time with us today. I'm curious, I know it sounds like you all fared relatively well and you dodged a bullet as the hurricane turned south a little bit. But can you describe a little bit what some of these other hospitals are going through? We sort of say in shorthand they had to evacuate their hospitals, but my gosh, that is quite an undertaking. What does that look like for those hospitals that have had to do that in the last couple of days?
Yeah, so I'm sure their hospital was prepared, but probably not quite as prepared as we were, because we were in the warning area. They were in the watch area. There's a level of difference of intensity of how the hurricane team A's sort of activate and get ready for this. You see our aqua fence up there. We were really barricaded in. We came into the hospital on Tuesday evening, and most of us stayed here until well into Thursday afternoon or Thursday night, ready to take care of patients. Just to give people an understanding, when an ICU patient is being cared for, it's a 1-to-1 nursing ratio with a team of physicians taking care of that patient. There's pumps that are plugged in, these electronic pumps delivering medications 24 hours a day. There's a ventilator that's plugged in, delivering breathing, critical things the patient must have to live. They require power supplies. These hospitals have generators, but the manpower that it takes to care for one patient is intense. So thinking about not just one patient, but a unit, an ICU unit, which might be 10 to 14 patients in a given space, that's going to require a large amount of manpower to be able to safely move those patients out of that unit.
You mentioned, Dr. Wilson, the aqua fence, and we put up a picture of it just a second ago. You all at Tampa General have taken extraordinary measures in the last decade or so to really change the way you think about defending yourselves against hurricanes. Can you explain a little bit about what that is, if we might see it at other hospitals, and some of the other things you all have done to protect your hospital?
Absolutely. So for some historical quirks, our hospital is actually on an island in the bay in Tampa, in Hillsborough Bay in Tampa. And in 1985, there was quite a bit of flooding in a low-level area of the emergency department. A lot of lessons learned from there made the generators move up to the top of the hospital. The emergency department now sits over the 100-year floodplain over, it's very high up in the air. And you see this aqua fence, which can take on 15 feet of storm surge, and over 100 miles per hour of wind. It's held up well. We tested it in Eta in 2020 and prevented quite a bit of flooding when the rest of the area had flooding. And so we feel very good about the ability to maintain power. There's a power plant, a power supply at the hospital itself. And we know we can ride out these storms for a long period of time in a safe way for our patients and our team members.
Emergency room physician at Tampa General Hospital, Dr. Jason Wilson, thank you very much for being on this morning, taking the time.